of new daily coronavirus infections in the country, second only to New Jersey. Many experts say that we're in for a fourth wave of COVID cases. So the new spike mainly being driven by the COVID variant first detected in the UK.
The rise in cases comes at a time when the CDC reports a record number of vaccinations in the U.S. So when might we see an end to the pandemic? Joining us now, Dr. Marty Makary. He is a professor at Johns Hopkins School of Medicine and the Bloomberg School of Public Health. Earlier, just a few months ago, he was on Good Day. He predicted that we would reach herd immunity in April. Doctor, okay, April has 30 days, right?
That's right. Give it some time. There's some good stuff happening nationally. But you know what? The New York City tri-state region and Michigan are lagging behind. We're seeing outbreaks of young folks. They're just last in the vaccine line. Remember, these are often asymptomatic and mild cases. Not to downplay it, people should take precautions. Kids should be careful. But let's remember, this has a case fatality rate similar to seasonal flu in healthy kids. And if you've got chronic conditions, you have to be really careful. This is still a very contagious virus and deadly in certain populations. But nationally, we're seeing a good trend. And even though numbers are up now, they're up among young people, and they're up about 10% from where we were a couple weeks ago in New York.
So, I mean, the good news is that they're not getting deathly sick, right?
Hospitalizations are down, deaths are down, so we're seeing some good trends. If you look at what's happening right now in the country, we're seeing a vaccine race that's beating out the new variants. Doesn't matter what the variant is, the vaccines are encompassing them. And, you know, we don't really have to guess in predicting. We can look at the UK and we can look at Israel. Once you start getting 50% of the adult population vaccinated, you see numbers of hospitalizations and deaths drop like a rock. And we're pretty close. We're at 40% nationally, and we're adding about 1% per day.
You've talked about how we should factor in natural immunity in addition to those getting vaccinated, that's the way to reach the herd immunity.
Yeah, we've got about 105 million Americans now with vaccinations, and we've got about another 100 to 120 million with natural immunity from prior infection. If you look at some of the research from Dr. Racanciello from Columbia, who wrote the book in virology, he says we've really been looking at this wrong. We've only been talking about antibodies as conferring immunity when really T cells can be activated and give immunity. And I think that's right. And natural immunity appears to be pretty effective. A big study showed that less than 0.6% of people get the virus again, and oftentimes we believe it's asymptomatic or mild.
When we see the second, the third, the fourth wave, it seems that there's a tie into holidays. If you think about the spike in Thanksgiving and Christmas, and then it went down, and then we see it perhaps go back up with the spring break, not that that's a holiday, but you know, with Easter, Passover. Will we see it again?
Well, look, most of the people that have died this week got it about 4 to 6 weeks ago. And I think right now the spring break phenomena has resulted in that part of that increase in young people. Remember, the fastest growing group in areas like Massachusetts are people aged 10 to 19. What were they doing over spring break? They were probably traveling. And so that's where we got to be really vigilant.
So, Doctor, I read your latest opinion piece in the Wall Street Journal, and you said the reason why maybe we haven't reached herd immunity just yet is because Dr. Fauci maybe made a mistake?
Well, it's an entire old guard medical establishment. A small group of people are making all the decisions, and it's so frustrating to see because we could have been at a much better place right now. Why were we vaccinating people already immune with natural immunity first in the vaccine line? That's about a third of Americans. We should have asked them to step aside. And why were we giving 2 doses on that rigid schedule on which the vaccine was approved when we could have given 1 dose first, delayed the second dose, and saved more lives? Look, it's no longer a philosophical debate. The UK did that. They've now immunized close to 60% of their adults with 1 dose. And guess what? They had about 10 deaths this weekend. They're doing great. They're going to beat us there. That was the winning strategy, and that got shut down by the old guard establishment.
Interesting. But why then is, like, London shut down still if they're doing so great?
Why is London been shut down? So Europe has been under basically a lockdown, but it's not a function of the lockdown. We're seeing other countries in Europe, Germany, France, under identical lockdowns, but they're having massive surges in cases. Look, people are still getting out. But the difference between the UK and France and Germany is that France and Germany have very low vaccination rates, and the UK is at 60%. So vaccination rates drive everything, and that's where we should have been. We should have been focusing on first doses. You know, if there's multiple people swimming in the ocean and you've got 2 life preservers, why give both to the same person? The first dose is 92% effective, and we believe it prevents death and hospitalization as well at 4 weeks.
Why are we seeing the devastation in Brazil at this point? So many deaths.
It's really tragic. Brazil has a lot of poverty, a lot of density. It's a very populated country, and we're seeing basically an unvaccinated population get exposed to another wave of the infection.
And these vaccines, I mean, we're just hearing that they last about 6 months.
Right.
Are you hoping that they last a little bit longer so we could get through the summer and party a little bit?
Well, I think that's been misinterpreted, that they last about 6 months. It's only been 6 months that we've been tracking how well they do. And I think if you look at the number of antibodies that is created, especially with that second dose, they're probably going to confer lifelong immunity. And I sort of agree now with the trend of a lot of the virologists saying, hey, we probably are not going to be bringing people in for boosters based on where we are right now.
So if you already had COVID, can you get away with just getting 1 dose?
I recommend 1 dose for people who have already had COVID, because your body's essentially already been sensitized and that immune response has already been activated. So having COVID is like having a first dose.
You know, we need you on for like at least a half hour to an hour, okay, Dr. Makary? Next time, we need to eke out a little bit more time with you.
It's good to be with you guys.
All right, from the Johns Hopkins School of Medicine, we appreciate Dr. Makary.